Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to this episode. Today we're talking about recognizing Iliopsoas issues. How are you going today, Sophie?
Hi Raquel, I'm going really well. Looking forward to this episode because it's been on the list for ages and it comes up in discussion most days, and there's never a time when it doesn't seem to incorporate in most horses. So looking forward to this discussion.
Yeah, so I've recently had jelly looked at from an Iliopsoas perspective, rectally, by Dr. Louise Cosgrove. And he, as suspected, because he has an underlying muscle disorder, and I think any horses with an underlying muscle disorder, such as PSSM, myofibrillomyopathy, are going to be more prone to Iliopsoas injuries. So, considering his background with struggling with a canter, as well as, he's been in eventing and he's had a lot of time of postural weakness, and postural kind of struggling with his postural balance, I suspected, and he's had difficulties with picking up his hind limbs, like a lot of these signs that I suspected that his psoas would not be healthy at all, and from what I could feel externally. And yeah, so it did show that he'd had a lot of kind of scarring within there, so like repeated injuries, and that one side was quite weak and contracted, and the other side was also not functioning optimally either. So he had double whammy there. And then Ellie had a fall, I don't know, a couple of months ago now, and she's showing signs of iliopsoas injury, which we're going to talk about. And yes, she had her right psoas was not working properly either. So, and they're just two of my horses. I know if I got my other two done, they would also have issues there, because this muscle is just such an important stabilizer muscle, and we're going to kind of talk more about that. But so many horses are struggling with that. So when we talk about the Iliopsoas group, we talk about as a 3-muscle group. So we talk about it. Do you want to go through those 3 muscles?
Yeah. So there's 3 muscles, and like you were just saying, it's often referred to as the iliopsoas, and sometimes it's called the iliopsoas muscle, but there's no muscle that's actually termed iliopsoas. The combination is the psoas major muscle, the psoas minor muscle, and then the iliacus muscle. And they have 3 slightly different roles, but they're a complex where they work together for different movements of the lumbar, lumbosacral, and the hip motion as well. And those 3 muscles together, they're really important as a complex in that space. And then the psoas major and the psoas minor, as a fun fact, are the only muscles on the underside of the lumbar, and they travel forward through the little hole where the aorta comes out of the thoracic cavity into the abdominal cavity, and those little muscles stretch forward inside, just between the 2 sides of the diaphragm, and they attach onto the underside of the last few ribs. And so, they're the only muscle underneath there, so their function is incredibly important for lumbosacral flexion, and also just stabilizing and playing a role in the health on the underside of the spine.
Yeah, they also attach into the vertebral bodies under there as well, specifically the psoas major, so that even, correlates with that level of support. The psoas major also blends with the iliacus tendon onto the lesser trochanter of the femur, which is on the inner aspect of the femur. And so the psoas major and the iliacus are specifically the iliopsoas. And then the psoas minor comes from the vertebrae, lumbar and thoracic vertebrae, onto the psoas tubercle on the ilium, on the pelvis. And so that helps with that lumbosacral pelvic flexion. So when we look under dissection, the iliacus goes along the underside of the pelvis, but it also joins onto the sacroiliac ligaments, the wing of the sacrum, and part of the psoas minor tendon in the origin, and then blends with the psoas major in the insertion. It's a really important aspect of hip flexion and rotation. And under dissection, so the best psoas muscles that I've seen were in the conics in the Netherlands. They were so fleshy and well developed. And I think every domestic horse that I've been a part of in the dissection, they've generally, except actually one I did myself, when was that? A couple of years ago. He was put down due to a front end injury. So he had arthritis in his pastern. And so his psoas were actually pretty good, and he hadn't had a heap of riding. They were pretty meaty and pretty well developed, but the majority of domestic horses that I've been involved in the dissections, they've been just quite weak, contracted. Just their color is not great. Like they're just not a healthy looking vascular kind of muscle. And the other thing was, in a dissection a couple of years ago, I dissected out the lumbosacral plexus and where the femoral nerve runs between the psoas major and minor. And like, if you can see how, if those are dysfunctional, like contracted, really tight, or if the iliacal fascia, which sits over the top of them, is super tight, how that nerve is going to become compressed. And yeah, just cause a lot of issues with its normal functions. So I was quite surprised, when I did do that, just how easily that dysfunction in that area is going to affect the nerves to the hind end. So yeah, it's an area that's weak in a lot of horses, and we need to understand how we're going to strengthen it, which we're going to go into a part 2 of this episode, and talk about that.
Definitely. And all of those muscles have a postural component. They have a power generation component, and they also have an endurance component, because all three of them have a mixture of different fiber types that serve different movement roles differently. So,
And it's understanding with different fiber types, which we'll probably do a podcast on this, but we can influence that through the way that we train horses. So yes, certain breeds are predisposed to certain muscle fiber types, and also certain horses, like depending on how they've been trained, will have a different predisposition of the fiber types. But I do think that we easily kind of train the power generation and endurance aspect more than the postural aspect of the psoas and the iliopsoas area. And we need to consider, especially early on in horses' careers, how we can train the postural muscle fiber types, because they really give stability to that area and then allow that improved transmission of power through that hind end.
definitely.
Yep.
Oh, I was just going to talk about the signs of dysfunction.
Yeah, cool.
And things that owners, body workers, vets, trimmers, they might see out and about as symptoms of iliopsoas dysfunction, especially seeing as it doesn't always present as a lameness. And they can include hind limb dragging. So that might be like They don't really pick up their back feet. I know I've seen a few where the horses with a very unengaged iliopsoas complex were dragging their hind feet, causing a lot of wearing of the toe, etc. And that resolved just with simple exercises that engaged and activated those muscles over time. It might include horses that snatch or, take their legs away from the farrier. Often you'll see kind of like a jerking motion where they kind of pull it up medially towards their tummy, especially when you first pick up the leg, like it's almost going into a spasm, and then sometimes they'll reef it back as well. You might see reduced engagement, an inability for them to come through or for them to lift through the back and pelvis. Sometimes in body work or when people are doing warm-up exercises, you can do pelvic extension and flexion. So that looks like a rounding response, or when you scratch on the top of the croup and they flatten out. And you'll often get a jerky response, or the horse might kick out, or they'll step to the side rather than give you that kind of motion.
And that's if you're doing it in a way of asking for motion and not in the reflex way, because if you're doing it quite quickly, you'll get a reflex jerky motion. So if you're asking for it in a slow and controlled way, but it's still jerky and braced, then, or stepping off to the side, or one side is lifting, other side is not lifting, yeah, then that can be a dysfunction there.
Yeah. Certainly something you've had with jelly, that one-sided motion.
100%, yeah.
Yeah. So other symptoms can be horses who are, being camped under. That's a symptom for a lot of issues, but this is one of them. Tenderness or reactivity just in front of the tubercocci, like in the flank area, through the lumbar, sometimes through the medial groin when you have a feel up on the inside of their leg. Also just a generalized lack of hind end strength, impulsion, and engagement through that area. If you've got dysfunction in one space, you often have muscle balance that's off. The activation of different muscles isn't quite as synchronized and as harmonious as it should be. And then also a weak top line is another sign that you are probably having some issues there, because they work synergistically. Good motion through the lumbar and the lumbosacral area is combined with healthy motion through the craniothoracic and the lower neck as well. The ability to move between those places and lift through the back is very important with psoas. So that's another sign you might see. We just spent some time looking at trying to understand the diagnostics via ultrasound for the iliopsoas. Would you tell us about what you found?
Yeah, just before we go into that, I just want to add some things to the dysfunction. So when you're talking about lack of impulsion, like basically, when the horse is able to bring that hind limb through appropriately, they bring it through and they push in a place of strength. So they push. The active part of propulsion is like when the leg is like vertical. And so you get the push from that position, whereas what happens with horses with psoas dysfunction is the push is often out behind them. So you'll see the maximum push, and this takes, for your eye to develop, but you'll see that they're pushing off with the hind limb out behind them instead of pushing off in a place of support, like directly underneath the hip. So that's one aspect that can be a bit more subtle. The other aspect is like when you ask them for a half halt or a transition, it can be disjointed, kind of wonky, and the hind end can kind of pop up instead of coming underneath, especially into a downward transition. And these horses can also struggle a lot with canter. So, that ability to flex the hip, flex that lumbosacral area. So there are a few others. And the other one, I had a horse the other day, trying to think what horse it was now, but I picked up the leg and I took it out the back and it didn't pull it away from me. It didn't do anything. And I continued to put a little bit of pressure, like pushing the leg out behind, nothing, no response. So a normal muscle response in that situation would be once you kind of reach the length of that muscle, like there should be a bit of a reflex contraction of that muscle because the muscle is saying, oh, like, oh, I'm lengthening. Actually, that's as far as I want to lengthen. But this horse, I just, like, I stood there for ages with it, kind of pushing it back a little bit. And I had to kind of tickle it up on its lumbar area to get it to reactivate and actually pull the leg back. So that horse, there's no way that horse could push in a strong place because it couldn't even recognize that its leg was out behind it. So it couldn't be pushing in a strong place. That's probably, I haven't had one like that for a while. It was bilateral. I have had them occasionally where it's more unilateral, where you take the leg out behind and they don't pull it back. So to me, that is the muscles are really like switched off. They're not recognizing, they're not. So if you kind of have something in your arm, in your hand, and it's quite heavy, your biceps here will hold a little bit, and then it will probably try to counteract that weight, so that you don't drop it. Whereas in this case, like there was just nothing. It wasn't doing any reflex kind of hold against me. So that's probably less common, but you should consider that. And then the opposite of that is like what you said with the farrier thing, except like Jelly, he struggles to take his leg out behind. So he'll kind of, like you said, how they pull it up medial. Well, he'll just pull it like he will pull out medial to begin with, but then it's like he can't let it go. So this is the opposite to what I was just describing. And you can't fight him in that because basically, like what you said, the muscle is gone into almost a state of spasm and brace. And so all you can do in that situation, and it's really important for people to recognize this, is if your horse can't take the leg out behind, don't force it out behind because the muscle is generally not in a healthy state. So you need to wait until they find that ability, or the muscle finds that ability to relax, and then like wait until they can take it out the back. And then sometimes Jelly will then get to the point where he also doesn't reflexly pull it back. So it just shows a big dysfunction of his iliopsoas muscles in the ability to flex his hip. So yeah, the more we can recognize those signs, the more you can help them.
Yeah. And we actually saw that with my dog as well.
Yes,
do you remember?
yeah.
Emma, yeah, she actually had she's had a handful of injuries in her life, and yeah, when you were treating her hind limb literally just like had absolutely zero reflex, recoil, traveling forward or activating. It's exceptionally better now, and with a lot of those sit to stand exercises. Yeah, and a lot of toe tickles and things like that have made a big difference, but yeah, it was very distinct.
And she had that typical, like what we see in horses with psoas contraction, like that flexed pelvis, camped under type of look. Like she always looked like she was
And a very
cowering.
straight back leg.
Yeah, and the straight back legs, that's also, you'll see that in horses too. So like when Ellie injured her psoas, her back legs went really quite straight looking. So they can get a bit peg leggy. And I have a dog, it's iliopsoas injuries are super common in dogs because of how they take off, running, and they jump in and out of the car and things like that. And it's much easier to diagnose from an ultrasound perspective, which we're going to go into. But like my dog is more like a horse, so he's a Great Dane Cross. What is he? Great Dane Cross Wolfhound, and his psoas, because you can actually palpate it on the dog, which is, you can't get your hand in there on a horse, but on a dog you really can get your hands in under the psoas, and his is horrible. Like it's got hard bits in it, calcifications, like big stringy bits, and I know when we had him, he's done a lot of jumping up and down, like vertical jumping, and I reckon he also did it before we got him when he was like less than 12 months old, because yeah, it's an absolute mess in there. So then that gets us now onto the diagnostic aspect of it.
Yes.
So yeah, much easier in dogs.
And much more spoken about as well. I know that, the time that you spent with Louise, you guys had discussions about, the prominence of it in discussions, whether that's in like the vet world or other spaces. But, it was very easy for us to just find this on dogs. It just pops up in PubMed or anything like that. But there's virtually nothing with horses. I found one video assessing the pelvis that, with an ultrasound on YouTube, and there's only a brief cover of the fact that you can look at the muscle bellies and the muscle tendons in there.
Yeah, and like Louise kind of talks about that we should be looking at this area as a part of our lameness exams in horses, specifically obviously for hind limb lamenesses. And to do that in horses, we need to do it rectally, via palpation and ultrasound, because we can't access it externally. We can access, like, I will assess the rib function, like especially the last two ribs, because we've said the psoas attaches there. I will assess like the hip function. I will feel across from the hip to the last few thoracic, and from the hip to the tubercoxy, and you can access a little bit of the iliacus in there from the hip joint to the tubercoxy. There's an area in there where you can palpate it. And then also like pelvic function, lumbosacral function, those sorts of areas, but we're not palpating it directly. The psoas, where we can palpate a bit of the iliacus directly, but yeah, we can't palpate the psoas directly. So an ultrasound to get a diagnosis is going to be your best way, but you'll need to kind of find a vet who is familiar with ultrasounding psoas muscles. And Dr. Kerry Ridgway talked about this years and years ago when I did a course with him about the importance of recognizing psoas injuries. Like, I did the course with him probably nearly 10 years ago now, and he was talking about this area and how vital it was that we were recognizing injuries and treating them. And he had a test where you kind of stand behind the horse, which is only for experienced practitioners that know what they're feeling, because if you do this too hard, it might be bad. But you're like behind the horse, feeling in front of the tubercoxes, and you're just kind of tractioning them slightly caudally, and kind of pushing a little bit inwards, and you can see if the horse reacts. And if they're super strong in their psoas, there should be no reaction whatsoever. Like, they feel so strong. But yeah, it's just not very common that I feel horses that are like giving super strong results there. So if we talk about like how do horses get injuries? Like, what are some just non-traumatic ways that they can injure their psoas?
So, simply being the result of poor posture in other places as well, like that's compensatory issues, especially the hip in particular, hip dysfunction, hind limb dysfunction, that relates or causes the hip to be in a different position, changes the position of the muscles, the length that they travel between their origin and their insertion. You just did a webinar on that.
Yes, we did just do a webinar on the hip.
Yep.
So
And
which
then
comes into all of this.
And then, of course, all the spaces that the muscles stretch between. So you've got the lumbar, the sacrum, the hip, pelvic function, all of those bones are moving together, through a joint range of motion. And so as that happens, the muscles are lengthening and shortening as they contract and lengthen. And so when you don't have a body that is making the most of its range of motion or doing so in a healthy way, then you have issues coming up within the muscles. So, what comes up for what you were talking about for the psoas muscles that they were seeing on ultrasound, those are fiber tears, chronic fibrosis, there's lesions, possible musculotendinous junction issues, and they can all be compensatory. You can think about the pelvis angle. It can be very flat or very steep. Sometimes that's reflected through the shape of the top of the lumbar into the sacrum. It can be very flat, or it can be very curved where the tail comes, down, or it sits up high. And that obviously that's when we're talking about a postural issue, not just a conformational issue, like you see some horses that have, Arabians perhaps that tend towards having a more flat sacrum and croup. What else do you think?
Yeah, and I think even with that, when they are more flat, you've got to consider how they're engaging through that psoas. Like that can increase strain, especially if you're asking a horse with a flatter pelvis to engage or jump. Then that's like what you were talking about with the distance that the muscles have to work over. I think too much work is probably a big one, and fatigue. Like we're talking about how the muscles are composed of like both postural muscles and power and endurance functions. And I think especially, young horses, and any horses with weak core, any horses that aren't pushing appropriately through their hind legs, it's going to fatigue really quickly. And so a lot of the time we probably don't realize that we're going past the muscle's point of fatigue. And so there's just that little micro strain on micro strain on micro strain. Or, we jump the horse two, 3 times this week, and then we go and competed over the weekend in 2 competitions, like 2 days in a row, and we've traveled it too. So the psoas is stabilizing in the travel, and then you've got the competition work, whether that's jumping or dressage. I don't think it doesn't matter, but if we've done a lot of collected work in the week, plus we're asking them to compete, plus not just compete, they have to compete twice in one day, sometimes twice in one day and then twice the next day. That is just, it's going to 100% be fatigued. And unless you're doing exercises to help get that muscle back into a healthy state in between, like you're just leading to kind of chronic weakness, and it's not going to be obvious at the time. So definitely through that. And then we just got to consider things like hoof balance. It's going to have a huge impact on how the limb goes through its range of motion and where it's pushing from. And so that will determine how much strain is put through the psoas. Saddle fit, we do the best we can, but it's really hard to get it perfect for the dynamic horse. And so if there's any kind of saddle fit challenges, then that's going to influence the ability for the horse to engage that hind limb and lift through the base of the wither. And then surfaces, especially like when we're working through a lot of deep sand, the psoas is really going to cop it then, because it's trying to suspend and keep the horse working. And then like also obviously your suspensories and distal limb cop it, but they cop it once your psoas gets tired. So that's the other important thing about the iliopsoas area, is it's supporting those distal limbs. So your tendon function, and once it gets tired, then the distal limbs are going to cop it. And then all of a sudden you've got a suspensory issue and you have no idea why, but it's like you've got this chronic underlying postural core weakness that needs to be addressed, and working in sand will always add to that. Anything else you want to add there?
Not especially. I mean, the hoof imbalance is a really big one, and not just medial lateral imbalance, but
No.
the alignment of the angle of the dorsal and the palmar and plantar, well, the plantar, because just we're talking about the back leg, but the hoof wall, is the is the toe too long with the heels underrun? Is the horse at risk of possibly having negative plantar angles and all of the extra impact that's going to have coming up through the limb? It's well documented now, and there's papers on the fact that it increases tension through the tendons, which obviously is going to change the function of the hind limbs. And it's something that you can't really out body work bad feet, and you can't out posture bad feet, but you also you want to be addressing it from multiple issues if you do have hoof issues. So, whether it's x-rays or you're having somebody who really does have qualifications and understanding the biomechanics of the hoof to get on top of that, because I think the equine documentalist has said that it was thermography or scintigraphy or something is, the NPA was really strongly correlated with lumbosacral issues.
Lumbosacropelvic issues. Yeah.
So it's really important to get the hooves in a good state if you're looking to improve the space of your iliopsoas complex.
Yeah, and also if you've got a gelding, then you need to consider the effect of gelding scars. So like I've had a fair few that I've treated externally where the pelvis has been kind of stuck in flexion. And their gelding scar from an external perspective has been very active and very large. So that's going to increase the strain like through the psoas and just the fascial connection through there is going to have an influence on the iliopsoas. And the same with mares and ovaries, like they sit very close to the iliopsoas, to the psoas specifically. And the fascial tension is going to have an effect there. And so like there's external gelding scar and adhesions, and then there's internal gelding scar and adhesions, which also need to be felt from a rectal perspective, and that can cause an issue with the iliacus specifically if they've got inguinal ring kind of issues there. So just considering those as an extra effect on the iliopsoas area. And then like thoracic sling weakness and poor postural strength. So, that's where the functional posture course comes in. Like we really look at horses' postural strength. And if their core is not strong, you need to figure out the underlying reason that it's not strong. So one thing I've noticed with Ellie, so she had some ovary issues and a right psoas issue. And over a week, so I haven't done anything with her much over that week because I've been away. But when I came back, so she's always had this, especially the last 6 to 12 months, really weak core. Her belly just looks dropped. And then when she trots, she has a real downward swing of her back. And when I came back, I was like, oh my God, Ellie looks like she's kind of gone and sucked her belly up. But that's because now she actually can. Like everything was uncomfortable in her ovaries and the psoas. And so now it looks like she's developed a core over a week through doing nothing. So that if you're struggling to develop your horse's core, you need to get to the underlying cause of the core weakness. And that's like a reason that I hadn't started her, because I'm like, I can't hop on a horse whose back is not able to support itself, let alone support me and a saddle. So being able to understand what poor core strength looks like, and then the potential causes of that, and that's where the equine functional posture course is really useful in that space. So yeah, that's talking about kind of non-traumatic aspects, like just postural aspects. But then we have traumatic aspects. So what are some traumatic things that could cause an iliopsoas injury in your horse?
Very common things like slips and accidents in the paddock. And that can include doing splits or having their legs slip out behind them. I've seen that in muddy conditions, horses galloping into the corner of a paddock where the gate is, and then doing a spin, and their back legs have like slipped out behind them.
Yeah.
And with the splits, I think a big one is horses that pull back and sit down and their
Yeah.
legs splay out to the side. So those kind of traumatic issues, it's a lot of force traveling through those muscles when it's not supposed to be or at an angle that it's not supposed to be. Other traumatic issues, you talked about the fact that the nerve travels between the psoas muscles and also the nerve root of that femoral nerve travels right over the tendon of the psoas minor. So tension on that nerve with slips and falls is also an issue. Other issues include legs getting caught in fences, so they can get cast, or if their leg gets stuck in a fence and they're pulling, you're going to have a lot of force traveling through those muscles. What else can you think of? Or
I think the other
examples?
one is even horses like kicking out, so like the horse that kind of runs off and does a big buck, but like they've got dysfunction in there, or they kick out and twist or something like that.
Yeah.
Or they like rear up and flip over and twist on their leg, or those sorts of injuries. Yeah, like you see some horses running around, especially if it's muddy too, but like I know with Jelly, he can deal with it a little bit better now, but like when he would run and kick out, that would always kind of flare him up a little bit. He wouldn't feel as good after he'd done that. And he never kicks out. Also, just the quality of his kick out. He never actually like kicks out straight. He always like kicks out on an angle.
Right.
And I think that's probably that inability to extend his hips because of the iliopsoas contraction and many, many scars on top of each other.
Yeah.
So yeah, then he kicks out awkward and that doesn't help him either.
Definitely. And it's worth just what you were saying about the fact that we're going to go into this in the second part of this mini series on the iliopsoas complex. But just worth pointing out what you were saying about the fact that horses who do something as simple as kick out or buck, when they have dysfunction in place, that sets them up for an injury, which means that prevention through good, keeping a supple and healthy psoas actually prevents injuries to a degree. So it's preventative work to get them into a healthy state rather than to be coming back from an injury that you didn't need to have in the first place.
Yeah. So when you're with your horse next time, like I'd really ask yourself, how does your horse pick up the leg? Can they take it forward and backwards in comfort, or is there resistance and brace? And also just observing when they're moving, can you see where their push off is? Like where the most force starts from the hind limb. Like, do they push off in the center of what we call the stance phase? So like the center position of when that hoof is on the ground, or do they push off when their hind limb is actually quite far behind them or a little bit behind them? And that will take a bit of development of your eye, but there are a couple of things that you can start to think about, like are there any transition issues? Does my horse struggle with canter? Do they struggle when I ask them to engage? How are they with picking up their legs? Those sorts of things. Start to think about that because yeah, it's just really not uncommon. And the more you can recognize it, then the more you can help your horse posturally, and then they will have a longer performance life. But yeah, it's a very important area for any horse, especially if they're going to be ridden, especially. Yep. Awesome. Okay, well, thank you for joining myself, Dr. Raquel Butler and Sophie Vanderberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights with everyone. Make sure you join us for next week for part 2 of this Iliopsoas discussion. And yeah, thank you.
We'll see you in the next exciting episode.